பெல்லாம் எதுவும் இல்ல சார், நான் சொல்றதுதானே டைம்.
ஆமா, நீ தான் டைமர் வச்சுட்டு இங்க உள்ளே நடக்க போற. நான் நீ மட்டும் உள்ள போடு. பண்ணிக்கோடா. இல்ல ஒன் பண்ணலாம். இப்போ குவிஸ் ரிசல்ட் மட்டும் அனௌன்ஸ் பண்றோம். குவிஸ் ரிசல்ட் அனௌன்ஸ் பண்றேன். நேரா வந்து அவங்கலாம் வந்து நியர் ஸ்டேஜ் அந்த பசங்கலாம் கனெக்ட் பண்ணிக்கலாம். இது என்ன பிளேயர்ஸ் அதுக்குள்ள கனெக்ட் அவங்க
Good evening, everyone. I welcome you all to the MEDTADCON 2022's Master Quiz Finals. So after the preliminary round conducted yesterday, the top 5 teams were selected for finals. Now I call upon our young and energetic senior resident of internal medicine, Dr. George Sir, to announce the results.
Good afternoon. So the prelims round results will be like the first team which is entering the final round is Team Detimus, Danush, Bhavadarshini, and Sona. Yes, come to the stage. Yes, they have scored a mark of 124. They have given 34 positive response and a 12 negative response. Next team qualified would be Diabetic Elements. So Renita Jacob, Beatrice Blessy, and Ajay Mani Subra. They have scored 123 marks with 32 correct answers and 5 wrong answers. Then the third team which is qualified is Insulin Dice, Anusha, Ajay K, and Alina John. So their mark was 113. So with a 32 positive answers and 15 negative answers. The next team which is getting into the final round is Glimepiride, Glycoside, and Glibenclamide. Sam Paul, Nitya Varshini, and Neha. The next team which is qualified is Team Twinstan. Yesterday we had twins who were participating in the prelims. So Team Twinstan, Kaushik, Vasantan, and Mayan.
Now, the representative from Marrow will now display a short video about pre-G entrance preparation by Dr. Abbas Ali.
Minutes and give you a general idea. And these are the things that I've basically understood about the next exam. And whatever I tell you right now is based on whatever little we know about next and how it will have a lot of clinical focus and the days of so many exams and MCQs testing a lot of clinical subjects. But this is what I want to tell you. Number one, second year MBBS is personally, I believe, the foundation of how you become a doctor. If you ignore your second year, you will constantly keep struggling, understanding the things that you will have to read in the final years. And not only in final years, but eventually when you become a doctor who's practicing, you will struggle understanding the terminologies that are used in pathology, and you will always struggle understanding which antibiotics works for which organism if you come across a patient with sepsis or infection. So I personally believe second year is the founding stone of good clinical knowledge. You cannot learn clinical subjects without understanding the second year subjects. Please hammer this into your head. Pharmacology, microbiology, and pathology, these three subjects are used by every clinical specialty, whether it is ENT, ophthalmology, medicine, surgery, obs-and-gyn, pediatrics, orthopedics, anesthesiology, psychiatry, dermatology. Everyone will have to use drugs. Everyone will have to deal with patients who have diseases. So you need to know pharmacology, you need to know pathology. And everyone deals with some form of infection, whether it is skin infection in dermatology, GI tract infection, or UTI, or appendicitis, or osteomyelitis, or septic arthritis, right? Or infections in the eye. All of these doctors or clinicians will need knowledge of microbiology. So micro, patho, and pharma are indispensable for your knowledge. I'm not going to talk about first year subjects, but those are also extremely important because they give you the canvas to work on to understand the clinical subjects. Now, the problem with second year subjects is that because you're starting your second year, you will not have much knowledge to go by because you're just coming from anat, physio, and biochem. So you do not have much knowledge to completely understand the pathology and the microbiology and pharmacology. You will have what I like to call as islands of knowledge. Right. So you will have islands of knowledge. So you will know a drug that has an action, a particular action, say in illness, but you will not know how it helps in clinical practice, right? Because you've not read medicine yet. For example, you will understand that this kind of tissue heals much better compared to that kind of tissue. And you will not understand the implication of that yet. But when you read surgery, you will understand that this is the time a surgeon removes the sutures because this heals rapidly compared to that part of the body, right? And you will understand the tumor because you don't understand the tumor's presentations of a tumor in surgery or obs-and-gyn. You're reading it in pathology, you know that this is the histological lining of that tumor, and then later on you will understand that this tumor can produce this kind of manifestation, and this is how the patient will present to you clinically. So what I'm basically trying to tell you is, because you have limited knowledge in second year, you'll not be able to correlate completely in terms of the big picture of clinical practice. So this is where the teacher comes in. This is where the teacher comes in, who helps you correlate this. I mean, you can learn and correlate this by reading textbooks, but obviously you will not have that much time, right? You'll be busy reading the pathology and the micro and the pharma. How will you go about reading, the presentations and the management? You will not. So the teacher basically comes in, whether it's a marrow teacher or your teacher or any teacher, basically comes in and tells you, "Ki beta, this is the organism that you're reading in microbiology, right? And this is its presentation in the form of infection, and the patient will have fever and such and such. And because this is this organism, it is coagulase positive or gram negative, and I forget, but you understand, right? If that is that organism, and this is the reason this test comes positive or this test comes negative, and this is how you differentiate them clinically." So that is an important role of the teacher. Now, unfortunately, if you do not have teachers, marrow teachers can help you, and you can watch the videos and learn this correlation completely. What I'm trying to tell you is, second year is a place where everything is important, but you do not understand its importance, right? So you will start building these knowledges, islands of knowledge, and teacher will start correlating. You can do that with the textbook, but it is difficult. Now comes the question of what textbooks to read. Now, there are so many textbooks. There are Indian authors, there are foreign authors, and there are standard textbooks, there are short books, there are review books. I will tell you this. Reading a textbook is important. We underestimate that. We think, just watching the videos or reading notes or finding some small short book will solve the problem. I think it will only solve the problem of helping you pass an exam, but it will not help you become a good doctor. And unfortunately, the next exam is an exam that will not be easily cleared just by knowing facts or just by knowing the important stuff. Next exam, because it has so many questions coming from a particular subject, it gives it a scope of asking you so many things from different angles, which basically means that they will test your understanding rather than your ability to memorize important topics. Because questions can come from topics that are remote, questions can come from topics that are rare. So they will be basically testing your ability to understand, comprehend the problem, and then solve it, right? They are going to test that. That is why next is important. That is why next is revolutionary in terms of making good doctors. So if in order to prepare for next, you need to read textbooks. And I'm not saying reading textbook is extremely important, and if without reading textbooks, you'll not be able to clear it. No, you can, but it will make your life easy. Now, I understand reading textbooks are hard. And again, that's where your teachers comes in. That's where your classes come in. And that's where we, in the form of marrow videos, come in. If you're finding difficulty understanding something that you're reading in a textbook, you can read the textbook after you have watched the video. The teacher will explain it so nicely. And every teacher is going to only teach you from standard textbooks. They're not going to teach you something else. In fact, they'll teach you more than the standard textbook, something like your professors would teach you. So watch the video and then go and start reading the textbook. Now, when you come to reading the textbook, you will find it's easy now because you've already understood it. Teacher has explained it to you so nicely. And sab samajh aa gaya tumko. And now you're going to read the textbook and underline the points that teacher already highlighted for you. That makes your life easy. Another thing is, don't get lost in the information. Before approaching a textbook, make sure that you mark the questions, the topics that are relevant for your exam, because not only are you going to prepare for next exam, you also need to pass your second professional exam, right? So open the textbook, mark the topics that are relevant and important for your particular exam, and then start reading it, paying more or close attention to the topics that you have marked. Thereby, what will happen is you will avoid wasting a lot of unnecessary time reading things that are not relevant for you at that particular time, because there is so much to know and you cannot know everything. So I prefer starting from topics that are relevant and important for the exam and then encroach in areas that are not so important. For example, if you're appearing for microbiology exam, everybody knows the Staphylococcus, Pseudomonas, Pneumococcus. These are extremely important organisms. And till 2 years ago, nobody read about coronavirus. But now everybody will read about coronavirus because now it has become relevant. So you need to keep updating the list of topics that are relevant. And this will only happen when you listen to teachers or you watch videos and you know what information is relevant for your exam. So this is how you should go about it, right? Now, another thing is, like I said, I already said this, do not read cover to cover, just focus on the areas which are relevant for your exam, and you can read the textbooks after you watch the videos. Now, watching the videos or reading the textbook is basically helping you assimilate a lot of information. Okay? And there is so much information. So what do you need to do with that information? You need to put it in a place so that you can come back to it effectively and efficiently, right? You cannot come back to the textbook again and again because it's voluminous and it is all over the place. So this is what I suggest. Make notes. Make notes. Make your own handwritten notes. It can be on an iPad, it can be on a book, it can be on anything. But the point is you make your own notes. Why is this so important? Why do I keep stressing making your own notes? Because see, if you were an intern or in a final year and you did not have ample time, buying ready-made notes would have been an easier option for you because time is important. But right now you're in second year and this is the only thing you have to do, right? You don't have to read so many things. These are the 3 subjects you have to read right now, right? So make your own notes. And the advantage of making your own notes is that you process the information in your mind. And when you process the information in your own mind by yourself, you're basically learning it and you're paraphrasing it and rephrasing it and putting it on a piece of paper. What is the advantage? Your brain has already processed it. You're not taking the information and memorizing, you're processing it. This is different from memorizing. Do not memorize, process right now, process, and then reproduce it on a paper. And then what will happen? When you look at the notes, you will realize the teacher explained it in that way and I wrote it in this way. So there is a discrepancy in understanding. So you will explore more. You'll go back to the textbook and you will understand better and more. And in fact, you will understand better or more than the teacher possibly. This can happen if you start processing. Instead of being a blind believer, question, read the textbook, and this will make your life very, very easy. Process the information. Please process the information and put it on the piece of paper. Okay? Make notes. Ye baat hogi. Second thing is the advantage of notes is because it's concise and because it's in one particular place. Anytime you come across any doubt that you remember remotely from microbiology or pathology or pharmacology, you can quickly access the notes, open it and find it. And this helps you revise. And if there was something that you did not understand properly or you had written wrong, you can make the correction right then and there and make it better. So that is your version 2 notes, version 3 notes, version 4. And this keeps on happening till you reach your final year, right? So if you have your good micro notes now, until final year, you don't have to make any other notes. You just keep on updating that and it will act as a photographic memory. Any kind of memory you want to call it will be there and you know which page to look at it. And every time you look at it, it will rise. And when you go to the exam, it will be like a reflex. Every question ka answer reflexly niklega. And that is why I believe make your notes, particularly in this phase of life. Another important thing I want you to understand is most of the people think in second year that instead of reading subjects properly, they should go in a system-wise approach. What is this system-wise approach? System-wise approach is, suppose you want to read, the systemic pathology of liver. So what you read is you read liver pathology from pathology, the drugs for liver in pharmacology, and the organisms that infect the liver from microbiology, and the clinical manifestations and presentations of liver failure from medicine, all of this. You can do that. But right now, because you're in second year, and I told you, you have islands of information, your knowledge is not so comprehensive to jump from subject to subject, right? So it will be very tedious and difficult. And you will end up burning yourself out and start hating the subject because you're not understanding it clearly. So I prefer in second year to have a subject-wise approach. So patho pura padho, pharma pura padho, micro pura padho, per subject padho. Don't, overlapping them. Beyond that. So stick to the subject-wise approach in second year. By the time you reach third year and final year, you'll be exposed to more clinical cases, and you will understand what is the correlation. A patient of liver failure, why does he present with ascites, and what is a transudate, what is an exudate? All of these things you'll understand. A patient with a bone marrow failure will have splenomegaly. Why leukemia patients will have this? All of these things will start correlating and starts making sense later, but not right now. So stick to subject-wise approach rather than system approach. But if you have your notes handy again in the future, you can just label the chapters in your notes as, a GI system or MSK, musculoskeletal system, or, central nervous system. And then you can come back and review them system wise later in the future. But right now have a subject wise approach, right? Now, in second year, because you have ample time, so patho, pharma, micro, yes, they will consume a lot of time. But if you are fast reader, if you are more motivated and dedicated, you will save some time. And instead of wasting that time, just browsing Netflix and doing something unnecessary, I want you to do this one thing. You can do one of the two things. Either you can go back to the first year subjects and read them, or you can move on to the surgery and medicine and read them, whatever. So divide your time. Suppose you have 2 hours extra free because you're smart, you're faster than everyone else. So this is only for people who can do patho, pharma, and micro and then still save some time. This is not for everyone. So if you can save more time now, this is how you utilize that time. You utilize that time to go and read the first, second, and third year subjects. How will you read this how will you read these first year subjects? The first year subjects you will read by watching the videos and doing the question banks. Make notes from videos and question banks. Why again? Because you want to make notes and save them for your next exam. Okay. And the remaining half time or the extra time that you have left after finishing patho, pharma, and micro, you can start reading surgery or medicine. Again, these are extra options, extra things that you can do if you're a fast reader or a smart student. Otherwise, focus primarily on building patho, pharma, and micro. Make proper notes, read standard textbook, watch videos, solve the Q bank. Solving the question bank is extremely important because it will highlight the important areas in your textbook and videos. That way, you will remember, you will know what to remember, you know what to focus on, because everything is so important, right? Right now, because you don't know what is important, you will feel everything is important and you will keep on revising and reading everything again and again. But that is not helpful. You have to remember things that are relevant, that are important, right? So how will you know what is normal? Without knowing normal, you will not be confident knowing the abnormal. So this is what you can do to compensate for the loss of clinical exposure in this lockdown and COVID periods. Otherwise, I think I've given you a rough idea, a good sensible idea of how you can approach second year in static form of second year for next. Watch the video, read the marked textbook, make notes, do the question bank. That's it. If you have time, go to first year and final year surgery and medicine. First years, what will you do? You will do videos, Q bank, and notes. And final years, what will you do? Medicine, surgery, just read the clinical basics, go to the postings, keep your eyes open, ask question, understand what's going on, and whatever they teach you that day, come back, open the book and read. It might make sense, it might not make sense, but read it. That's what you need to do. Build your capacity to read enormous subjects like medicine and surgery, and you will be thankful later on. That is how you approach second year for next preparation. If you have anything else, ask me. I'm always available to help you. All right, guys. Bye-bye.
Knowledge increases by sharing, but not by saving. To share this knowledge, we have now gathered here for the Master Quiz Finals of MEDTADCON 2022. It gives me immense pleasure to introduce our quiz organizing team. The quiz finals will be chaired by our HOD sir, Dr. TKV Sharavanan sir. Dr. George sir will be our quiz master for the day. Dr. Aishwarya ma'am will moderate the session. On the monitor, we have Dr. Nivedana. And among the audience, Dr. Nishant sir helping us with the audience questions. And Dr. Murali as well. The timer will be coordinated by Dr. Prem Devi. Okay. I would like to inform that we shall have a few questions passed on to the audience. And if you guess it right, you will get a prize from Doc Tutorials. Or at least Quizmaster might even GPay you some money. So please stay tuned with us throughout the entire quiz. Okay. Now that everybody is assembled, let me brief you upon the rules for the event. The finals has 6 rounds in total. The history round, the connections, the case scenario, image-based round, a suspense round called out of the box, for which the rules will be told just prior to the round, and finally the rapid fire round. If there happens to be a tie, we will have a tiebreaker round, and please note the quiz master decisions will be final.
Okay, good afternoon to all. So we'll start the program without any delay. Okay, so already time constraints irukkiradanaala we'll start it right away. Just we will check the buzzers. Okay, we'll check the buzzers, right? I'll just say your time starts now, and you can all try to press the buzzer as soon as possible, and it will display who presses the buzzer first. Okay, your time starts now. Yes, diabetic elements have pressed the buzzer. Okay, the buzzer works, right? Yes. So we'll start the session. Okay. Yes. Is everything visible, ma? Everything is visible, right? For you, everything is visible. Okay. So first round would be history round. So the rules for the history round is like it's as simple as that. I'll just tell the rules. 1 minute for one personality. You can just identify who the personality is, and if you can just tell what he has done to the diabetes world. Okay. Just identifying the person itself gives you 20 marks, and there is no negative marking. Okay. So the first question will be from team A. First question will be for team A. Okay. No buses. No buses. First question will be for team A. Okay. Any doubts? No doubts, right? Okay. Yes. Yes. Identify the personality. Before previous one. Okay, yes. Your time starts now. 1 minute time. Yes. Yes, correct answer. Yes, Thomas Willis is the correct answer. 20 marks for the 20 marks for team A. Okay, next is next. Okay, the next question for team B. Team B. Okay, this question is for team B. Yes.
Sir, Dobson.
Yeah, full name. Okay, yes, Dobson is the correct answer. Matthew Dobson is the correct. Because of time constraints, I'm not explaining more about the personality. Okay, sorry for the inconvenience.
Paul Langerhans.
Yes, what?
Langerhans. Paul Langerhans.
No, wrong answer. So we'll go to the next question. Team D. Yes, identify the personality. Yes.
Joseph Frank.
Yes, correct answer. John and Peter Frank. Okay, yes. Next question. Next to the team E. Yes, identify the personality. Yes, identify the personality. You want to attempt something or what? Yes. No, wrong answer. So by team results will be announced so we are coming to the first end of the first round. Okay, but I could not explain the each personalities, but in the coming rounds we'll discuss more about diabetes. Okay, so at the end of round 1, team results will be announced by Dr. Aishwarya.
So team A gets 20 points, team D, they also get 20 points each. Team C and E have not scored anything.
Okay, thank you, ma'am. We'll go to round 2. Yes. Ma'am, that is team A, team B, team C, team D, team E. Okay, we'll move on to round 2. Yes. Yes, round 2 is actually a connection round. Okay, round 2 is actually a connection round. We will give 4 pictures. Okay, 4 pictures, and each picture is linked to a proper diagnosis. Okay, so you have to identify the diagnosis, and the diagnosis gives you 20 marks. Okay, so the diagnosis gives you 20 marks, and if you wrongly answer the diagnosis, you have negative marking. Okay, 10 marks will be deducted for the wrong diagnosis. Even for the past question, negative marking is there. Okay, so and if you can link each image to each image to the diagnosis, you will get additional 5 points for the each image which is linked. Okay, so you have 4 images and 20 marks for the diagnosis. And if you link each image to the diagnosis, you will get additional 5 points for each image. Okay, so there is negative marking. 10 marks will be deducted. Okay, 1 minute time. Yes. So if you want to pass, the buzzer will start. Okay. Yes. So first question goes to team E. Yes. First question first. Team E. Team E. Yes. Link all 4 images. So if they do not answer, other teams have buzzers in hands. So the first image is there is a boy, and second image there is a pedigree chart. Third one there are
Modi.
3 ladies, and fourth one.
So,
Yes,
Modi, MODY.
loud.
Maturity onset.
Yes,
of
excellent
diabetes.
diagnosis. So the diagnosis is maturity onset diabetes in
of
young.
young.
Yes, can you link all 4 images, ma? Yes.
So the pedigree chart denotes
First
autosomal.
image. Can you link it or not? So 20 marks for team E, ma'am. 20 marks for team E. What is this image?
Less than 25 years of age.
Yeah, very good. Age less than 25 years. Second image.
Autosomal dominant.
Very good. Autosomal dominant pedigree charting. Yes. Third image.
Female predominance.
No, wrong
more
answer.
common.
Wrong answer. It is actually, it
Runs-
involves at least 3 consecutive generations. Okay. Yes. Fourth question.
Sulfonylureas.
Yeah. What is it?
Drug of choice.
Yes. Actually, some of the types of MODY will respond to sulfonylureas. Okay. Yes. 3 images are correct, ma'am. Yes. We'll go to the next team D. Next. Yes. 4 images. Actually, it is the very easy question. 4 image. Yes. 1 minute time. Time is running.
Explain.
Yes. You have. Yes.
Gestational diabetes.
Yes, excellent diagnosis. Gestational diabetes mellitus. And what is the first image? This one.
Pregnancy, sir.
Yes. Second one. Okay, what is the third image?
Macrosomia. Big baby.
Yes, it's not macrosomia actually. Macrosomia is there, but it's large for gestational age baby. Yes, very good. Fourth answer is
The blood pressure.
it is associated with what?
Hypertension.
Not exactly. It is actually preeclampsia. Okay,
Preeclampsia.
proteinuria and high BP refers to preeclampsia. Okay, so 2 images are correct, ma'am. Yes. Next question to team C. Yes. Team C. 40 seconds more. Yes, can you link all 4 images, ma'am? Only 10 to 12 seconds more.
Sir, it's type 2 DM due to PCOS.
Yes, very good. Answer is
First,
polycystic ovary syndrome. And yes, can you link the image, ma'am?
Hirsutism,
Yes, very good. Hirsutism.
acanthosis nigricans,
Yes, acanthosis nigricans, which is a sign of insulin resistance. And third one is,
female have male-like pattern of growth in the body
what is it actually?
due to more testosterone.
What is it?
Uh,
Okay, we will give you marks. Okay, it's actually, it is hyperandrogenism. Okay,
yeah.
hyperandrogenism. Yes, then it is actually string of pearls appearance in ultrasound imaging. Okay, so PCOS, hirsutism, acanthosis nigricans, hyperandrogenism, and string of pearl appearance. So 3 images are correct, ma'am. Okay, now the question goes to team B. Yes. So these are sugar cubes, not ice cubes. Okay. Yes, time is running. Yes. உங்களுக்கு தெரியலனா இதல கூட பாத்துக்கலாம். Yes, only 20 seconds more. Five seconds more. Okay, time's up. So we'll start the buzzer. Okay, yes, have the buzzers in hand. Wait. Yes, okay, yes. Okay, yes. Buzzers on. Yes. So team detimers. Yes, answer. Mic kudra. Yes.
silent MI, sir.
Yes, very good. Excellent diagnosis. Silent MI. Actually, it was very easy. If you see only these 2 images, it is very easy. Yes, can you?
Hyperglycemia,
Very good. Hyperglycemia.
autonomic neuropathy,
Excellent. Autonomic neuropathy.
silent
Silent
MI infarction.
and infarction. Yes, excellent diagnosis. 20 plus. So since it was a past question, for diagnosis you will get 10 points, and for each image they will get 5 points, ma'am. Okay, yes, we'll go to the next question. Next question is for team A, twin stance. Yes, team A. Actually, the question is very easy if you just think in a normal way. Yes. Thirty seconds more. If they don't answer, we will come to the audience. Okay. Yes. நீங்க டிஸ்கஸ் பண்ணி அவங்களுக்கு சொல்லி கொடுத்துறாதீங்கம்மா. எஸ் team A. Wrong answer will have -10 marks. Yes. Okay. சொல்லிட்டாங்களா? Okay, yes, tell the answer, ma.
SGLT2.
Yes, very good. SGLT2 inhibitors. Very good. Excellent answer. What is the first image?
It glycosuria, sir. So urinary tract infection.
Yes, very good. Urinary tract infection. Yes, this image.
Reduces BP. Reduces BP.
Yes, it reduces BP also, and
Weight loss.
it causes weight loss.
Cardioprotective.
Yes, very good. It is cardioprotective.
$65, team D 50, team E 35.
Okay, now team C is leading with the 65 points. Yes. Okay, we'll go to the round 3. Round 3. Actually, round 3 is pictorial round. You will have yes. One minute. Okay, so you will have to see the image and just tell the diagnosis. Okay, yes, we'll start with team A. Yes, question number. Yes, one minute. Correct response will add 20 marks to the for the diagnosis, and 10 marks will be deducted for the wrong answer. Okay, so 30 seconds for each question. Okay, 30 seconds for each image-based question, and wrong answer will have minus 10 marks. Yes. Yes, pass question will also have minus 10. Pass question will have, if you answer it correctly, you will have 10 marks plus. Okay, yes. First question goes to team A. Yes, what is the diagnosis? Single answer, no explanation, single answer.
Charcot arthropathy.
Yes, very good. Charcot joint. That is due to? Yes, okay. You will get marks. You will get marks. Okay. Yes, Charcot joint. Okay, Charcot joint is actually a combination of diabetic microangiopathy. Yes, it is both neuropathy as well as microangiopathy. Okay, yes. We'll go to the second question. Team B. Yes, diagnosis. Don't just simply answer பண்ணிராதீங்க. Just think and say. Yes.
Macular edema, sir.
No, not exactly. Yes, we'll start the buzzer. Okay. Yes. Okay, we'll give half mark for your answer. Okay, it's actually half correct. Okay, we'll give 5 marks for the team, ma'am. Team. No. Yes. So buzzers on. Yes. Anyone? Nobody is willing to answer. Okay. Yes. You want to answer? Okay. Yes. Twin stand.
Papilledema.
Very good. Excellent answer. Papilledema. Okay. Can you say what is it due to? You will get 10 points. Okay. What is it due to?
Sir, cerebral edema, while acute correction, there will be.
By? Yes, very good. Rapid glucose correction can cause cerebral edema
More than 100 milligram per
and
deciliter.
papilledema. Okay, it's not diabetic nephropathy. I thought you will be answering diabetic retinopathy, but it's actually papilledema, which is due to rapid glucose correction. Okay, rapid glucose correction. Yes, ma'am. Team A is getting 10 points. Actually, macular edema is also a part of papilledema. Okay, so I'm giving you half of the marks. Okay, yes. Yes, the third question for team C. A 65-year-old female with long-standing diabetes now comes with abdominal pain and back pain.
Emphysematous pyelonephritis.
Yes, very good. Very good. It was actually easy question. Okay, very good, very good. It is actually emphysematous pyelonephritis. So you have this black color thing, air inside the kidneys. Okay, which is due to gas-producing organisms. This is one of the unique diabetic infections. Okay, yes, very good, very good. Yes. Next question. Yes, for team D. $25 seconds more. Just one single answer. One single answer. Actually, it is also an easy question. Don't think so broad. Okay, it is also easy.
Diabetic neuropathy.
No, it's actually wrong answer. It's not diabetic neuropathy. Yes, we'll start the buzzers. Okay. Yes, hands on the buzzer. Okay, buzzers on. Yes. Yes, twin stance.
Distal sensory polyneuropathy.
No, wrong answer. So negative marks for both teams, ma'am. Team A and team D. Negative marks. So we'll go to the audience. Yes, can someone from the audience answer? What is this? Yes, PGs. Very good, very good. So it is actually B12 deficiency. What is it due to, ma? What is it due to in this case? Very good. It is due to metformin, long-standing, long period of time metformin will get B12 deficiency. So you have hyperpigmentation and Romberg sign is positive, and here you have vibration sense which is lost. Okay, it is actually B12 deficiency due to long-term metformin intake. Okay, yes. This was your team question, right, ma'am? Negative, okay, negative marking for team D, ma'am. Okay, yes. Now the next question is for team E. 62-year-old female with long-standing diabetes. What is it? Yes, a 62-year-old female. This is actually MRI image. This is a CT image. Those are virtual imaging. Yes.
Stenosis.
Time's
Renal
up.
artery.
Time's up. Okay, yes, buses. Okay, yes, bus around. Nobody want to answer. Okay, yes, team Decimus.
Sorry. End stage renal disease due to renal stenosis.
Okay, yes, come on once again.
End stage renal disease due to renal stenosis, renal artery stenosis.
Very good, excellent. It's not renal stenosis, it is renal artery stenosis. Okay, so see, we can see there is a stenosis of the renal artery here. Okay, and there are asymmetric kidneys. Okay, one kidney is small and one kidney is large, asymmetric kidneys. So the same image is actually repeated. Asymmetric kidneys with renal artery stenosis. Okay, that is actually one of what? Yes, very good, very good. It is one of the. It is considered to be one of the macrovascular complication of diabetes. Yes. Team is team C. Ma'am, plus 10 for team C. It was a past question, right? Plus 10 for team C. Okay. So we have come to the end of round 3. Now we'll go to round 4. Okay. Yes. We'll announce the results. Results, ma'am.
At the end of 3 rounds, team A has scored 80, team B
80.
80,
Team A 80 points.
team B 30,
Team B 30 points.
team C 95,
Team C is 95 points.
team D 40,
40 points. Team D.
team E 35.
Team E 35 points. So team C is actually leading. Very good to the pre-final year, guys. Okay, yes, very good. Yes, we'll move on to the next round. Okay, we'll move on to the next round. Yes, next question. So team 4 is actually clinical scenario. Okay, so you have a clinical scenario, and if you say the diagnosis based on the clinical scenario, no, we'll start with team A. Okay, team A. Okay, we'll start with team A. So if you say the diagnosis, you will get 20 marks, and you have 2 sub questions. And for each sub question, you have 10 marks. Okay, 10 points. And there is negative marking. Okay, that is actually not mentioned here. Okay, so 10 marks will be negative marking. If you say wrong diagnosis, 10 marks will be deducted. Okay, so 20 marks for the diagnosis, 10 marks each for each sub questions, and 10 marks will be negative marks for wrong diagnosis. Okay, yes, 1 minute for each team. Okay, now I'll actually say time starts now. Up a timer on panna podo. Okay, you have the timer. You have the timer. Time starts now. Timer start. Okay, yes. Question, please. Okay, for team A. Team A. A 38-year-old female, history of diabetes, hypertension, CKD. She required chronic hemodialysis for 8 years and often misses appointments, including 4 of her last 8 sessions. Comes to the ER complaining of double vision for 1 day. She also notes 12 hours of facial swelling and difficulty speaking. Appears to be moderate distress. Okay, so temperature is 39, BP is 155/95, heart rate is 110, respiratory rate is 25, and head examination demonstrates right-sided proptosis, facial edema, and facial palsy. So the WBC counts are elevated, serum glucose is high, and creatinine is high, hemoglobin is low. Sorry, HbA1c is high. So a needle biopsy was taken from the retroorbital mass, and yes, next slide. So this is the biopsy finding. Yes, next slide.
Rhinoceros.
Yes, what is the diagnosis?
Timer.
Yes, what is the diagnosis, ma? 10 marks for yes.
Rhinocerebral mucormycosis.
Yes, very good. Excellent answer. Rhinocerebral mucormycosis. And what is the yes, next slide. Yes, second question.
Mucor, rhizopus, both.
Yes, very good, very good. Mucor is the answer. Yes, what is the drug of choice?
Amphotericin B.
Yes, excellent answer. So the clinical scenario is rhinocerebral mucormycosis, which will have proptosis and facial edema and facial puffiness, facial palsy also sometimes. So the organism is mucor, and the drug of choice will be amphotericin B for 14 days. Okay. Yes. We'll go to team B. Okay, a 60-year-old male, known case of type 2 diabetes for past 15 years on medication, came with low back pain radiating to the back of right thigh, followed by weakness of right lower limb and history of weight loss. Erectile dysfunction, constipation, and orthostatic hypotension was present. Asymmetrical weakness, proximal more than distal. Okay, you can note this one. Asymmetrical weakness, proximal more than distal in the right lower limb. Sensory loss was also present. Okay, yes, what is the diagnosis? Yes, you can read the examination part and complaints once again. Yes, asymmetrical weakness, proximal more than distal of right lower limb with the sensory loss. So if you answer wrongly, you will have -10.
Diabetic neuropathy that includes autonomic neuropathy, amyotrophy.
Yes, what is it? Yes.
Diabetic amyotrophy.
Yes, excellent answer. Excellent diagnosis. Diabetic amyotrophy. What is it known as, ma? What is it known as? What's the name for that diabetic amyotrophy?
Bruns-Garland syndrome.
Very good, very good. Actually, it is Bruns-Garland syndrome. Excellent diagnosis. Actually, it was a tough question. Yes.
From pain, we can manage by giving duloxetine.
Okay, yes, very good. Yes, that's all. You will manage the pain. Okay, there is actually no treatment for this case ideally, but steroids can be tried in some cases. Actually, Harrison says steroids can be tried, but still there is actually no treatment. Only you manage the pain with some tricyclic antidepressants. Okay, yes, what is the common form of neuropathy in diabetes?
Distal sensory motor asymmetric polyneuropathy.
Yes, very good. Excellent. It is actually distal symmetrical sensory motor polyneuropathy. Sensory motor polyneuropathy. Yes. Full marks for team B. Yes, the next question. We'll move on fast. We'll move on. Next question, ma. Yes, this is for team C. A 45-year-old male, history of diabetes for past 4 years, came with complaints of abdominal distension and pedal edema for past 8 months, small joint arthralgia, generalized hyperpigmentation, polyuria, polydipsia, polyphagia, undergone treatment for infertility. On examination, testicular atrophy was present, hepatomegaly was present, inflamed second and third metacarpal joints on the right hand. Yes, actually it is a diabetes, small joint arthralgia, hyperpigmentation of skin, yes, polyuria, polydipsia, polyphagia, and treatment for infertility. Yes, can you connect all these? Your time starts now. Yes. Wait. Previous slide. Yes, 40 seconds more. Other people, buzzers la ready இருந்துக்கோங்க. Yes, arthralgia, hyperpigmentation, diabetes, infertility. Yes, 15 seconds more. Yes, team C. Okay, time's up. Okay, -10 for your team. Okay. Okay, it's actually you answer panla. Okay, we'll give 0. Okay. Yes. Okay. Buzzers on. Yes. Okay, glimepiride, glycoside, and glipizide. Yes. You tell me the diagnosis.
Bronze diabetes, hemochromatosis.
Yes, excellent diagnosis. Hemochromatosis. Okay, hemochromatosis. Patient has small joint arthralgia and generalized hyperpigmentation of the skin, that is bronzing of the skin, as well as diabetes due to involvement of pancreas, and infertility due to involvement of the pituitary. You will have what? You will have what? In hypogonadotropic hypogonadism. Okay, yes. So that's why bronzing of skin with diabetes, it's called as bronze diabetes. Okay, yes, excellent diagnosis. Next slide. Okay, what is the screening investigation of choice for the disease? No negative marks for this one. Okay, you can just attempt. Okay, yes. What is the screening investigation of choice?
So serum ferritin.
No, it's wrong.
Not ferritin. Biopsy.
No, wrong answer. Yes, what is the treatment modality? Biopsy is not actually screening. It is definitive diagnosis. Yes. What is the treatment modality?
Desferrioxamine.
Okay, before that.
Diabetes control, desferrioxamine, and.
Okay, yes, a better answer. Okay, we'll give 5 marks for the third question, ma'am. Diagnosis and 5 marks for third. Okay, so screening investigation of choice is not ferritin. It is actually transferrin saturation. Okay, it is not ferritin because since ferritin is an acute phase reactant, it is not considered to be a screening investigation of choice. So diagnosis is hemochromatosis and screening is transferrin saturation, and treatment modality would be phlebotomy. Okay, repeated phlebotomies. Okay, in regular intervals, we'll let out blood so that iron is not overloaded in the body. Yes, next question. Next question is for team D. Yes, next question is for team D. Yes, a 72-year-old male, known case of diabetes for 35 years. He is a widower and has been lying alone in his apartment for past 1 year. He was brought by her daughter in an altered mental status to the casualty. One episode of seizure was there and incontinence was there, urinary incontinence. So that's the vitals. And coming here, his CT brain was normal. CBG was 608, sodium 156, potassium 4.5, urea 112, creatinine 1.6. And those are the ABG findings. So pH is actually near normal. PCO2 is also near normal. PO2 is near normal. And HCO3 minus is also near normal. So if since you people are MBBS students, if you could could not interpret the ABG. It is actually ABG is near normal. Yes. Time has started already.
Hyperglycemic, hyperosmolar state.
Yes, very good, very good. The diagnosis is HONK. This is actually ABG will be near normal and patient will have normal to mildly hypernatremic state. Okay, and the CBG is so high. Why did the patient have seizure? Why did the patient have seizure? Okay, yes, next question, next question. Yes, what is the next step to confirm the suspected diagnosis? Diagnosis is correct. Yes, what is the next step? Yes, what is the treatment modality? What is the treatment for HONK state? Hyperosmotic non-ketotic coma state. You want to answer or what?
So regular insulin.
Yes.
Regular insulin.
Okay, treatment modality will be insulin.
Insulin and normal saline.
Okay, insulin, IV fluids, and okay, it's enough. It's enough. As of you, it's enough. Okay, the treatment would be insulin, IV fluids, and potassium correction. Okay, yes. What is the next step to confirm the diagnosis? You want to skip it or what? Yes, fast, fast, fast. Yes, we'll go. Okay, time's up, time's up. Yes, audience, what is the next step to confirm the suspected diagnosis of HONK? Yes, PGs. So the answer would be, it is very simple. It is calculating serum osmolarity. Okay, you should calculate serum osmolarity. So serum osmolarity will be high. Okay, that is why you call it as hyperosmotic state. Okay, yes. Ma'am, diagnosis is correct and one answer is correct, ma'am. Okay, yes, next question. Yes, next question for team E. Yes, ma'am, if you can't see, you can come here and see. Okay, here, an 45-year-old male known case of type 2 diabetes for past 10 years. Consulted diabetology clinic in view of uncontrolled FBS and PPBS. Even after hiking insulin dose multiple times, the patient was admitted. Even after hiking the dose, they could not control the sugars. The patient was admitted and continuous glucose monitoring was made, and this is the continuous glucose monitoring chart. Yes, time has started. Yes, if you can't see, you can come here and see. You can see the chart values if you can't see. Yes, other teams, be ready with the buses. Yes.
So Dawn's phenomenon.
What? Wrong answer. What? Midnight hypoglycemia. Okay, because of midnight hypoglycemia, you get excess of counter-regulatory hormone excess, and in the early morning you have hyperglycemic state. Okay, what is the treatment modality?
Should reduce the insulin dose.
Excellent answer. Reduce the night dose of insulin and the patient's sugars will come down. Okay, excellent. So this was a past question, right? Ma'am, past question, ma'am. 10 marks for diagnosis, 10 marks for each question. Yes. So we have come to the end of this round. So marks will be announced by Dr. Aishwarya, ma'am. Yes, ma'am. Actually,
So at the end of 4 rounds, team A has scored 120, team B 90, team C 95, team D 70, team E 40.
Okay, now team A is leading with 120 points. Team A, Princeton is leading. Okay, yes, we'll go on to the next round. Yes, rules. Actually, this round is called as out of the box round, and it is not at all from diabetes. There is no link of yes.
Last round we got 35 plus 15, 50 marks.
Okay.
Minus 10 for
Yes,
the
ma'am, yes,
wrong
ma'am.
answer.
Okay, yes. It is not related to diabetes. We have actually 6 questions. Okay, everybody have hands on the buzzers. Whoever time starts, okay, buzzer on abdin sonna odane you can start clicking the buzzers. Okay, so you have 1 minute for the diagnosis. Okay, only you can have the diagnosis. Okay, you should give me only the diagnosis, nothing else. So 20 marks will be for the correct diagnosis. 20 mark will be detected for wrong diagnosis. 20 mark negative mark. Okay. So anybody have doubts regarding this round? Yes. Anyone can answer. First question will be displayed. I'll read the question. Adukapram buzzers on sonnone anyone can press the buzzer. Okay, yes. So the buzzer will be displayed. Yes. Okay, we'll go to the first question. A 46-year-old male have the following manifestations: weight loss, intermittent destructive migratory polyarthritis, steatoria, lymphadenopathy, supranuclear gaze palsy, oculofacial myarrhythmia, oculomasticatory myarrhythmia, retrobulbar neuritis. Duodenal biopsy showed PAS positive macrophages in the lamina propria. Yes, and this is the biopsy finding: PAS positive macrophages in the lamina propria. Yes, it is actually very it's actually very classical. Oculofacial myarrhythmia, oculomasticatory myarrhythmia, retrobulbar neuritis, and PAS positive macrophages. Yes, buzzers on. Yes, glimepiride, glycoside. Wait. Wrong diagnosis will give you minus 20. Think about it and say yes.
Celiac disease.
Yes, wrong answer. Minus 20 for team E. Minus 20 for wrong answer. Okay, yes. Anyone else? We'll pass on to the audience. Yes. We'll pass the question to the audience. Team A. Audience pass pannilama. Yes, you. Yes, audience question. Yes, what is the diagnosis? Yes. Yes, excellent. Whipple's disease. Okay. What is it? It is actually Whipple's disease due to Trophirima whippeli infection. Okay. Yes, you will have steatoria, which is actually malabsorption syndrome, lymphadenopathy, and neurological manifestations. Yes, we'll go to the next question. Okay, a 45-year-old female, known case of HIV, not taking ART. Okay, not taking ART, comes with diarrhea for 3 weeks, associated with fever. Stool examination revealed what? Okay, it is a HIV, which is a immunocompromised state. Yes, buzzers on. Yes, glimepiride, glycoside. Okay, you have negative marking. Yes.
Cryptosporidiosis.
Excellent diagnosis. Excellent. It is actually Cryptosporidium parvum. Okay. So the diagnosis, any immunocompromised patient with a chronic diarrhea, you should suspect coccidian parasites. Okay, you have 3 coccidian parasites. And one among them is most common is Cryptosporidium parvum. Okay, which is actually a parasite. Okay, yes, very good, ma, very good. Plus 20 for team E, ma'am. Yes, next question. A 54-year-old male was recently diagnosed as ALL by his hematologist. He was started on with chemotherapy for the same. Next day, the patient complained of decreased urine output. Urine output was measured and was found to be 200 ml per 24 hours. So the urine output is low. Yes. Patient is started on with chemotherapy. And total counts are 4,000. Hemoglobin is 5. Urea is 97. Creatinine is 2.8, sodium 128, potassium. See, okay, just listen this. Sodium is low, potassium is high, calcium is low, phosphate is high, uric acid is high. Don't see the values, just see whether it is high or low. Okay, yes. Buzzers on. Yes, diabetic elements.
Tumor lysis syndrome.
Excellent, excellent answer. Excellent answer. So the diagnosis is tumor lysis syndrome. Okay, what is tumor lysis? A patient is having hematological malignancy. Okay, any malignancy, solid organ malignancy or a hematological malignancy, and patient has been started on with chemotherapy, and he is having hyponatremia, hyperkalemia, hypocalcemia, hyperphosphatemia, and hyperuricemia. Okay, so everything is high except for the calcium. Calcium will go down. So that is a medical emergency. Actually, you should immediately intervene. This is actually a case of tumor lysis syndrome. Yes, excellent. Ma'am, 20 points for team B. Yes, next question. So a 33-year, don't rush into the answers. Just see the question, read it carefully. 33-year-old female, known case of SLE on prednisolone, drug default, now presenting to the casualty in an altered state of sensorium. Patient was pale, peripheries were cold. It is actually very easy question. Blood sugar levels were 44, BP was 60/36, pulse rate was 98, and other system examination were normal. Yes, buzzers on. You have 1 minute time. Don't rush into diagnosis. Just read it carefully. And I have clearly highlighted the drug default. Yes, we'll pass on to the audience. Yes, diabetic elements.
Sir, on removal of steroids, sir.
What is it? What is it? Yes, correct answer. Correct answer. Yes, what is it?
Steroid removal.
Steroid withdrawal, actually. Okay, yes. Steroid withdrawal. So the answer is correct. Answer is steroid withdrawal. Okay. So a patient who is on long-term steroids, suddenly they have stopped steroids, they will have a complication of hypoglycemia and hypotension. Okay. This is also actually a medical emergency. It is actually iatrogenic adhesions. Okay. Yes. Iatrogenic adrenal insufficiency, actually. Yes, ma'am, 20 points for team B. Next question. Again, don't rush into diagnosis. 44-year-old male coming from Kanyakumari with unilateral leg swelling, cough and wheezing, weight loss, low-grade fever, lymphadenopathy was present. Total count is 10,200, which is normal, not normal, actually upper limit of normal. P45, polymorphs were 45, lymphocytes were 23, eosinophils were 32%, which is high, and serum IgE is elevated. What is the diagnosis? What is the diagnosis? Wait, I didn't start this thing. Okay, yes, buzzers on. Diabetic elements.
Tropical eosinophilia, sir.
Very good, excellent diagnosis. Tropical pulmonary eosinophilia. Okay, actually, a chronic filariasis patient suddenly developing cough and wheezing. You should suspect for tropical pulmonary eosinophilia, which will have high eosinophil count and high IgE. Okay, yes, excellent, team B. Yes, coming. Yes, we have a question for the audience. Yes, it is actually an easy question. We have a question for the audience, and you will be gifted with something which is sponsored by Doc Tutorials. Yes, question. A 37-year-old male came with complaints of acute onset paraparesis for 4 hours. History of loose stools with fever 1 week back. Patient was conscious and oriented. BP was 90/60. Pulse rate was 120. CNS examination revealed grade 2/5 power, hypotonia, diminished DTR. Sensory examination was normal. Plantar was bilateral flexor. Bladder and bowel was normal. So here you can see CSF studies. Protein was high. Total count was normal. Okay, what is the answer? Actually, it is very easy question. It is actually a acute onset hypotonia paraparesis. Acute onset flaccid paraparesis. Yes. Answer yes. Yes, very good, very good. GBS, Guillain-Barré syndrome. Okay, it is actually what is the CSF finding, Mahesh? What did you see in the CSF? It is actually albuminocytological dissociation. Okay, see, proteins are high and total count is normal. Okay, it is known as albuminocytological dissociation. Yes, round 5. Okay, yes, we have come to the end of round 5. The scores will be announced now.
So team A gets 120,
Team A 120 points.
team B 150,
Team B 150 points.
team C 95,
Team C 95 points.
team D 70,
Team D 70 points.
team E 40.
Team E 40 points. Yes, we'll move on to the round 6. Okay, one of you will come forward for round 6. Yes, come. One of you from each team will come forward. Come fast. Okay, can you people go down? Yes. Only one team. Team A will stand here. Yes. Team C then round the time. Yes, team A, come here. Yes, all others go down. இல்ல நீங்களா இருங்கம்மா. Only you go. அவ்வளவுதான். Yes, stand here. Yes, come here. Come. Yes, ma. Yes, face the audience. Okay, face the audience. You will not see the questions. Okay, on the board. Yes, face the audience. And one has gone to the restroom. He'll come back. Okay, yes. Okay, so we'll start the round 6. This is actually a rapid fire round. Rules. So you have 10 plus 1 questions, which is of the same pattern. Okay, every team will have a same pattern of questions. Okay, so you have 80 seconds. Okay. Yes, team members, listen. You have 80 seconds. Okay, you have 80 seconds, and you have to answer 10 plus 1, 11 questions. One is bonus question actually. You can have each question will have 5 marks each. Okay, ma'am, each question will have 5 marks each, and there will be no negative marking at all. Except for if you have extra time, you can review the questions. Okay, except for 2 questions which has options, you can review the questions. Okay, yes. We'll start for team A. Yes. Wait. Yes, your time starts now. Yes.
Beta. I cells.
Yes, I cells secrete. Time is
Next slide.
Next.
Next slide.
Yes. Okay. Yes.
Inhibits lipolysis.
Yes. Correct answer. Next.
Pre-diabetic fasting blood glucose range according to pre-diabetic 5.6 to 6.4.
Fasting plasma glucose range. Yes.
Fasting Next question. Which group does the following drug belong to? GLP-1 agonist. GLP-1.
Yes, very good.
Yeah, next slide.
Yes, next.
Type 2, glucokinase 2.
Yes, very good.
Next question. Suddenly experience hypertension. Home remedy taking the Dextrol.
Next question.
Name anyone in the following establishment format. PCOD.
Yes, correct.
Nadu time 10 seconds.
Yeah, okay. Okay, yes, எத்தனை answers, ma'am? Yes, you got 4 answers correct and 4 into 5 points anu சொன்னோம். 20 marks. Yes. Wait ma, நான் சொல்றேன். You want to attend one more time? Delayed. Okay, sorry for the delay. Yes. அங்க போய் இது பா. Okay, yes, we'll start from the first. Okay, sorry, it was a delay, time delay. Yes, pass. Yes, team A. Yes, start.
Vasoactive intestinal peptide.
Wrong answer.
Next question. Next question. Inhibits.
Yes, correct answer.
100 to 126.
Yes, correct answer.
Next question. Duration of glycogen. 12 to 24 hours.
24 hours. Yes, correct
Next
answer.
question. GLP-1 agonist.
Yes, correct answer.
Glucokinase 2.
Yes, correct answer.
Next question.
Yes, next.
PCOD.
Yes, correct answer.
Weight neutral.
No, wrong answer.
Weight. Oh, yeah.
No, you can't review.
Yeah. Next question. What is the ideal second online? Second also in patients who have compelling need to minimize hypoglycemia. Next question. Sulfonylureas.
No, wrong answer. Yes.
What is the stage 1? Clinical setting on diabetic nephropathy. Hyperfiltration.
Yes, very good.
Next
correct
question.
answer. Yes.
Previous question. SGLUT2.
Yes. You people are telling on answers, no? -5 for your team. Ma'am, answer சொல்லி கொடுத்துட்டு. Okay, ma'am, எத்தனை questions correct, ma'am? 7 minus 1, 6. Okay, 30 points. Okay, 30 points for team A. Okay.
Ajay Mani.
Okay, yes. Team 2. Team B. Yes, come fast, man.
All the
Yes, your time starts now.
Glucagon like peptides, sir.
Wrong answer. Time is going. Fast.
Promote, sir.
Yes, correct answer. You want to skip or
126 to 200 milligrams. 126 to 200 milligram per deciliter, sir.
no? It's no, wrong answer is
4 to 8 hours.
wrong answer.
Biguanide.
Yes, very good.
Insulin promoting factor.
Yes, very good. Excellent answer. Yes.
AC inhibitors, sir.
Which AC inhibitor?
Enalpril.
Time is going. No, wrong answer.
Next.
Yes. Next.
Name any only indicative following. Name one indication of following drug other than diabetes. Sir, high resource in heart failure.
Yes, very good. Okay, ma'am, how many? 4 answers correct. Okay, yes, you want to answer this? Yes, ma'am, you want to answer? No marks actually, just you can answer.
Weight gain, sir.
No,
Weight loss.
weight loss. Yes, next.
The case of type 2 DM on what is the ideal second line?
For whom cost is the major issue? According to ADA, you have 5 classes, which is considered to be second line. According to this one.
Glibenclamide.
No, no, actually, yes, it is sulfonylureas. Okay, yes, go. How many marks, ma'am? For 20 marks. 20 marks for team B. Yes, third person come. Team C. Yes, team C questions. Yes, shall we start?
Yes, sir.
Yes, team C start.
Next. Increases.
Wrong answer. Yes, next.
Increases. Promote on.
Action of insulin on somatostatin. Ah, yes, yes, correct answer. Yes, yes,
Sir,
yes.
time.
Okay, okay. We'll give.
Sir,
five.
So next. 5.7 to 6.4.
Yes, very good.
Two to 4 hours.
No, wrong answer.
Some meglitinides.
Yes, very good.
HNF 1 beta.
Very good. Excellent answer. Yes.
Audio Jungle.
Next.
Audio Jungle.
Next. Weight loss.
Yes, very good.
SGLT2.
Yes, very good. Very good. Yes. Yes. Extra 5 more. 10 seconds.
So I'll skip to the next questions.
Okay, I'll give you extra 15 seconds. Okay, yes.
Okay.
What is the kadaisi answer solra?
I don't know, sir. Next one.
Okay, you want to skip? Yes, go back.
Back, sir. Which drug can
15 seconds. 15.
Sir, start.
Wait. Ah, yes. Yes, rewind. Question rewind.
Name one indication of mental other than diabetes. Next
question.
So I'll answer that.
Yes. Okay.
Sir, metformin.
Which one?
This one.
No, wrong answer. Actually, euglycemic decay is this one. SGLT2 inhibitors. Okay. Ma'am, how many answers, ma'am? 6 answers correct. Okay. Yes, next person come to the stage. Yes, we'll start. Your time. Wait. Your team D, right? D. Okay, yes, start.
Somatostatin.
No, wrong answer. Next. Skip. Next.
Skip, sir.
Skip. Next.
Jungle.
Wrong answer. Yes. Next.
48 hours.
Yes. And correct answer. 48 hours. Yes.
Amylin analog.
Yes. Very good.
HNF 4 alpha.
Yes. Very good. Which anti-diabetic drug? Okay, anti-diabetic drug.
Pramlintide.
No. Wrong answer. Next.
Skip.
Yes. Next.
Weight neutral.
Yes. Correct answer. Next. Ma'am, how many answers, ma'am? 4 answers correct. Yes. Yes, coming to the team E, last team. Okay, yes. Last time you got 10 out of 10, right? Yes, last quiz, she got like 10 out of 10. 10 questions may correct answer. Yes, now let's see this round. Okay, team E, your time starts now.
GI.
Yes, correct.
GIP.
Correct. Yes.
Action of insulin on glycogenolysis. What action? Inhibit.
Yes, correct answer.
According to me, what is the sugar level with which is it?
Easy question.
So, more than 200
Yes, correct answer.
duration of action of glycine. So 12 to 24 hours.
Wrong answer. Yes, next.
So incretin analogs.
What is it? Yes, yes, correct. GLP-1 unlocks. Yes, next.
Affected protein in MODY type 3. So HNF1 alpha.
Yes, correct answer. Anti-diabetic drug. Okay.
So SGLT2 inhibitors.
Yes, very good. Correct. Don't say it. Minus mark.
The next.
Yes, next. Okay, you want to answer this? Yes. Chuma answer panma.
So weight loss.
Yes, weight loss. Next.
DM on metformin. What is the ideal second line in case of atherosclerotic cardiovascular? SGLT2 inhibitors.
Yes, okay, yes. It is either GLP-1 or SGLT2
SGLT2.
inhibitors. Okay, yes. Yes, okay. Ma'am, etna answers, ma'am? 6 answers correct. Yes. Okay, I'll say the answers. I'll say the answers. Okay, anyone from the audience want to attend some of the rapid fire? Or rapid fire attend pannuma? Yes. Actually, the session is going to be over. Yes. Shweta. Niveta. Yes, come. Yes, come. Just 2 minutes, we'll finish it. Anyone want to come and just. Yes, come. Fast. Fast. Time Anyone. Fast. Anyone want to surgery PGs? Surgery PGs yes. Shivakumar. Nishant. Okay, yes, we will close the session. So we have come to the end of round 6. So the quiz is over. Actually, romba fast conduct panna vendiya situation aiduchu. Okay, sorry for the inconvenience. Yes, the team scores will be announced.
Team E gets 7. This is the total score.
Total score.
Team E gets 70.
Team E 70 points.
Team D 90.
Team D 90 points. 90.
Team C 125.
Team C 125 points.
Team A 150.
Team A 150 points.
And Team B 170.
So the winner runners announce பண்ணுங்க. அத மேம் winners announce பண்ணுங்க. So the winners would be
Team B.
Team B. So the winner of the MEDTADCON quiz, diabetic quiz is Team B. Your name is? Renita. You? Ajay Mani? Blessley. Yes. The runners for runner up will be Team Twin Stand. Kaushik, Mayan, Vasan. Yes, the prizes will be given later. Yes, thank you. Thank you for the participation, and I would like to thank my teammates who have put immense effort in this session. Actually, so thank you all. Thank you.
Check. The valedictory event will commence soon, so I request all the audience to please remain silent. Silence. Keep.
Check, check, check.
Sorry.
Check. It's time for our valedictory ceremony to improve the golden moment of opportunity and catch the good that is in our reach is the great art of life. A very warm good evening to the invited guests, professors, students, and ladies and gentlemen. It's a matter of immense pride to stand here before all of you this evening. On behalf of the institution, we're delighted to offer a gracious welcome to all of you gathered here. It gives us immense pleasure to welcome you all to MEDTADCON edition 2022 Internal Medicine Tagore Annual Diabetic Conference, conducted by the Department of Internal Medicine, Tagore Medical College and Hospital, powered by the Indian Medical Association Students Network and MedUSAIN Med Education for All.
We are excited to announce that it was the first international annual conference organized by the Department of Internal Medicine of Tagore Medical College and Hospital. This international conference provided with an array of scientific lectures and events delivered by leading national and international experts, highlighting the various aspects of the diabetes specialty. These 2 days were filled with experience, which was garnished from a multitude of lectures, symposia, and workshops, alongside with various scintillating competitive events such as master quiz, research paper, and poster presentation. We are proud to announce that the organizing committee of MEDTADCON has worked tirelessly for the past few months, along with the support of our esteemed patrons and honorable organizations such as IMA, MSN, and Medicine, in order to present you all this academically sound experience.
I'd like to use this opportunity to thank our sponsors for this event. Our title sponsor, CBS, Marrow and ERIS Pharma. Our associate partners, Doctutorials, USV Tazlock, and Intax Pharma. Our educational partner, Mankind, Zydus, Renault Crit, and Diginerv.
Now, I would like to welcome the esteemed dignitaries to the stage. We would like to welcome our chairperson, Dr. M. Mala ma'am, and secretary, Mr. Manikandan sir. Since they couldn't attend today's event due to inevitable reasons, we will surely miss their presence. Now, I heartily welcome our dean, Dr. J. Muthukumaran sir, to the stage. We welcome you, sir. I would like to welcome our guest of honor for today, Dr. Palani Sami, sir, State President, IMA TNSP. Our special guest, Dr. Singara Velan, sir, MD, Vice President, East Zone, IMA TNSP. Event on an auspicious note, I request you all to kindly rise for Tamil Thai Varthu. நீராறும் கடலொடுத்த நிலமடந்தை கெழிலொழுகும் சீராறும் வதனமென திகழ்பரத கண்டமிதில் தேர்க்கணமும் அதிசிறந்த திராவிடனன் திருநாடும் தர்க்க சிறு பிறை நுதலும் தனித்தனரும் திலகமுமே அத்திலக வாசனை போல் அனைத்துலகும் இன்பமுற எத்திசையும் புகழ் மணக்க இருந்த பெரும் தமிழனங்கே தமிழனங்கே உன் சீரிலமை திறமியந்து செயல் மறந்து வாழ்த்துதுமே வாழ்த்துதுமே வாழ்த்துதுமே. I request all of you to please be standing because we'll be having the physician's prayer which will be delivered by our CRMI, Dr. Raghunathan.
Kindness and sympathy to my art. Give me singleness of purpose, strength to lift at least a part of burden of my suffering fellow men, and a true realization of a rare privilege that is mine. Take from my art, guile and worldliness, that with a simple faith of child, I may rely on thee.
I request you all to please be seated. Now, I would like to call upon the mastermind of this entire event, Dr. TKB Sharavanan, sir, Professor and Head of Department of Internal Medicine, Tagore Medical College, to address the gathering.
Good evening, all. So now we have almost come to the end of this very successful and highly informative international conference. With the blessings of the Almighty, I take immense pleasure in welcoming you to the valedictory ceremony. I would like to say that I am grateful to our chairperson, Professor M. Mala, Madam, our secretary, Mr. Manigandan sir, our Dean, Dr. J. Muthukumaran sir, our Vice Principal, Dr. D.H. Kobalan sir, our Medical Superintendent, Dr. Karnanidhi Ramaya sir, who have extended their support to conducting this conference, for being with us here to celebrate the victory of this event. I am extremely pleased to welcome our esteemed guest for this validity ceremony. I welcome the dignitaries from the Indian Medical Association, our guest of honor, Dr. Palanisamy sir, State President IMA, and our special guest, Dr. Abul Hasan sir, Chairman IMA MSN, and the President-elect IMA TNSB 2023. And Dr. Singarwalan sir, Vice President-elect East Zone IMA. And I heartily welcome our chief guest, Dr. Ramlur Pavanathan, vascular surgeon. And I am thankful to all our guests for cordially accepting our invitation and taking their time in putting their efforts to join with us and celebrate the victories of the delegates and success of this brilliant conference. With immense pleasure, I cordially welcome the heads, faculties, and staff of every department, and perhaps the most important of all, the delegates and students who have all joined and participated in the conference and its competitive events to share the happiness I have had conducting this conference on this evening. Over the past 2 days, the MEDTADCON 22, we have witnessed multiple scientific lectures from over 20 national and international speakers who have traveled all the way to Tagore Medical College to spread their knowledge about almost every aspect of diabetes. I am sure that every delegate has gained very valuable and salient information about this condition. The moderators who govern our every lecture did a great job of further exploring and extracting the more intricate information on the topics alongside captivating the audience attention. The ECG workshop, which was conducted by Dr. Srinivasan, sir, was very interesting and in fact an essential one for every medical student. He clearly explained all the significant points in such simple yet effective manner. And I am sure that every student here would have benefited greatly from this workshop. And the workshop on insulin administration conducted by Dr. A. Sundaram sir was a magnificent workshop. This workshop was the need of the hour as every delegate here, but for an undergraduate as well as postgraduate, which will require to master the skill of administering insulin. And I am glad that we have made this platform available for them to learn from such eminent personality in that field. The master quiz on diabetology conducted by our very own department was very exciting to watch. And it was very nice to see the enthusiastic participation from various colleges. And I appreciate the courage of every brilliant student who participated in the quiz. The questions were well set and innovative, making sure not only the participants, but even the audience kindled their brains. And the research paper and poster presentation events, which happened in the lecture hall too, both the events were very interesting, and it was surprising to watch that every participant present their papers and posters with such a keen interest and enthusiasm. It was evident that there was a lot of research and hard work put towards making their papers and posters. And the Just a Minute event was in fact a very entertaining to each. And every participant kept their best foot forward and was very clever and spontaneous. Overall, this conference, which involved such eminent personalities among the medical field and such talented students participating over the past 2 days, made me extremely happy and made this international conference conducted at Tagore Medical College for the very first time by our department is a huge success. As they say in the proverb, it is not the destination, but it is the journey towards the destination, which is very, very important. Likewise, it is not the winning, winning is not the only thing to be celebrated. It is actually the courage to actively participate and take part in everything, which should be celebrated and rejoiced upon. So I would once again like to say welcome everyone and congratulate every winner and participant in the MEDTADCON. Thank you.
Thank you, sir. Now, we like to call upon our Dean, Dr. J. Muthukumaran, sir, to express a few words.
Respected Madam Chairperson and General and Secretary, Tagore Educational Trust, and respected Chief Guest, Dr. Amalur Padanathan, sir. Abul Hassan, sir, and Dr. Singaravelan, sir. HOD, General Medicine Department of Tagore Medical College, Dr. Saravanan, Professor Saravanan, and his team, and dignitaries of the stage, and my dear students. Good evening to you all. This is the first time in Tagore Medical College we are conducting an international conference on diabetes. This is the first one of its first kind in Tagore Medical College they are conducting. It is a 2 days program. They have conducted many things in this program, like presenting so many papers. So they have discussed so many lectures, conducted a workshop and quiz program, and so many other things they have conducted here. It is really very nice program. As our HOD said, really the delegates would have gained so much of knowledge about diabetes by attending this program. Such a nice program it was. And finally, we have witnessed just few minutes before, we have witnessed one quiz program and rapid fire test. It was very wonderful. It was very excellent. The way they have conducted is really very much impressing. I thought it was the persons who are all attending were postgraduates. Finally, HOD only told they are all pre-final, final, and interns. Really, it was shocking. I just wondered, what is this? All these attended by only pre-final and final years. I was just asking like that. So it is really I am very proud of you all. And at the same time, I feel extremely proud to be your dean by seeing all this wonderful, knowledgeable, and intelligent students, by seeing this intelligent students. I'm not exaggerating, really. So it is very nice, very nice. Since we have come to the end of the second day program, and as I wanted our guest to take over the podium, I would like to conclude my speech by conveying my thanks to the organizer. Thank you. Thanks for giving me this opportunity. Thank you.
Thank you, sir. Now, we'd like to call upon Dr. Palani Swami, sir, the guest of honor, to express a few words.
Good evening to everybody. Respected Dean of Tagore Medical College, Dr. Muthukumaran, the chief guest of today's function, Dr. Amalur Padanathan, the president-elect of IMA Tamil Nadu State Branch, who is going to take over as the president in 2024, Dr. Abul Hassan, the vice president, Dr. Singaravelan, the doctor behind, the professor behind this wonderful international conference of diabetology, your own professor, Dr. Saravanan, and the faculties of this Tagore Medical College, my dear students. Again, a warm good evening to everybody. Really, I am very thankful to the Tagore Medical College administration for asking us to come over here and to participate in this wonderful seminar or conference. I have to thank the Medical Student Network convener, Dr. Raghunandan, who has asked me to come over here. And I thanks to the Dr. Raghunandan. And of course, you would have seen in the beginning of the meeting, after Tamil Thai Valtu, physicians prayer and IMA prayer were recitated. And only because there is an MSN wing which is very active in Tagore Medical College, I think they have done it. So I have to thank all the MSN wing of Tagore Medical College for organizing such a wonderful program and coordinating with the Professor Saravanan and of course your dean and others. Friends, actually it is really a great program wherein, as your dean has told, that the last program, that is, the quiz program, which we are witnessing. Actually, I was also thinking, myself and Dr. Amalor Pradhanathan, we were talking. We thought we were discussing that they are all PG students. That's what we are talking with, doctor, chief guest. Then only we came to know that there are pre-final, final, and interns. So it is actually not, your dean has praised, but apart from your dean, the guests which we have come over here to the program, if we praise that the medical students doing pre-final, final, and interns are doing such a very great, knowledgeable quiz program, means is really wonderful. So actually, I don't know, we also studied MBBS long time back, but we won't get such a programs at that time. We usually do hard work and we will come through, but it's very difficult to get through the examination at that time. But in spite of that, we'll get through the examination. Maybe the professors are sitting in, they will be knowing. But the programs like these are really inculcating the very knowledge in the minds of the young doctors. That is more important. And so many programs in so many colleges and so many places, we are conducting CME programs like this, and everybody is enjoying as well as they are acquiring knowledge, very good knowledge. So to empower the knowledge only, we are conducting such a seminars. And I'm very happy today that Tagore Medical College has already started this MSN wing, Medical Student Network. And also, I do hope that also JDN, which they are, supporting the Tamil Nadu state branch and all means. We had conducted a JDN MSN enclave, I think in June, I suppose, in Leela Palace Hotel, wherein more than 700 delegates, MSN and JDN, participated, and it is a very mega event. We have to thank Dr. Abul Hassan. He is the chairperson of the MSN JDN wing of Tamil Nadu state branch. He is able to concentrate on the MSN JDN wings, and he is motivating more young doctors and students to come to the Indian Medical Association fold. So my thanks to, I don't want to take much of your time because you are all eagerly waiting to receive your awards and everything. So I thank once again for calling us for this wonderful function, and we are really happy, even though there are heavy rains. Yesterday, Madam Dr. Aishwarya, your associate professor, was calling me. Assistant professor was calling me, sir, kandipa neenga vandruveengala appdinu kettaanga. நான் சொன்னேன், the rain has not stopped us from coming from Coimbatore. So I am very happy, and I do hope the same trend with the support of Indian Medical Association, this MSN JDN will do better in Tagore Medical College. Not only in Tagore Medical College, you have to propagate the MSN JDN to other medical colleges because you are the pioneer. You are going to motivate the other medical colleges to start the MSN and JDN wing. I am sure that Raghunandan and his team will do that. So thank you very much for the opportunity. Thank you.
Thank you, sir. Now I'd like to call upon Dr. Abul Hassan, sir, our special guest, to express a few words.
Good evening, all of you. Respected President of Tamil Nadu IMA, Dr. Palaniswamy sir, Dean of Tagore Medical College, Dr. Muthukumaran, Chief Guest, Dr. Amalor Pradhanathan, and Dr. Saravanan, Head of the Department of Internal Medicine, and IMA Vice President, Dr. Singaravel, and all the faculties of Tagore Medical College, and MSN JDN office bearers of Tagore Medical College, particularly our state MSN convener, Dr. Raghunandan, Kesav, C.T. Krishnan, and my dear friends. It is very nice to watch. We had the opportunity to watch the tail end programs of 2 days event. But I hope that you all had a very good academic feast yesterday and today. And the MSN Medical Student Network of Tamil Nadu State has been organizing many programs. particularly in the 2 years, the past 2 years. And, very many set level programs. We had one program mega event at Karpagavana Medical College last year. And I found that the students of one medical college, they were always bright and brilliant, and they become winner of the all-round performance. That is Tagore Medical College. And this is because of the motivation of the students and the faculty's support, and your state coordinator, state convener is from your medical college only. So I see that, students of Tagore Medical College have enormous strength to organize any kind of events. Today, this event, MEDTADCON is, has some national and international flavor with the participation of faculties from outside India. And, you got lots of opportunity in future also. And what you have to do is get yourself involved in MSN. Medical student network is like a blank canvas. It's a blank canvas. Whatever picture you want to draw, whatever program you want to design, you can design. IMA is always will support any kind of academic activity, any kind of research activity that MSN envisages, even today, tomorrow, in future. So IMA extends all the support on behalf of the president and on my own behalf as the future president of IMA. IMA will support all kinds of academic activities of Tagore Medical College. Management support, that is very crucial, and you are lucky that you are enjoying that kind of support here. So I wish you all a very good such events in the future also, and the support from our side is rest assured you. Thank you very much for the opportunity.
Thank you so much, sir. Now, we'd like to call upon Dr. Singaravale, sir, a special guest for today, to express a few words.
Good evening to all. My good family friend of your chairman, Professor Dr. Mala and Manigandan, and your Dean of Tagore Medical College, our IMA President, Dr. Panichami, and your own chairman and president-elect, Dr. Abul Hassan, and my good friend, Dr. Amalur Pranathan, and the HOD of Medicine, Dr. Saravanan, and very dynamic team of MS and JDN under the leadership of Raghanandan, very good friend, and all the faculties and my dear students. It really gives me a great pleasure to stand before you for such a organizing capacity of our medical students of Tagore Medical College. It takes me to my days where I was the chief staff advisor for nearly 10 years at Tagore Medical College, how students were active. After a few years, I could see how Tagore Medical College students are very much involved, and the amount of knowledge when the quiz program was conducted, thanks to the students who are actively involved, it gives you not only knowledge, and as our president told, you are going to be the future leaders of our association and you are going to lead the community. I wish that this type of academic activities encourage students' knowledge as well as their administrative capacity also. With this, I wish that such a good program should happen in future, and you all should be benefited by academics, by the various faculties of national and international nature. In this regard, I really congratulate our Dean and Department of Medicine for arranging this international conference, and also thank all the people for giving me this opportunity to take part in the valedictory function. Thank you all.
Thank you so much, sir. Now we'd like to invite our chief guest for today, Dr. J. Amalor Pavanathan, sir, to deliver a few words.
Respected Dean and my good friend, Dr. Muthukumaran, distinguished dignitaries from the IMA, Dr. Palanisamy from Coimbatore, Dr. Abul Hassan from Erode, and Dr. Singaravelu from Tanjore, coming from 3 different corners of the state on this inclement weather, just to honor the commitment that they have made to the students of Tagore Medical College. That indicates and reflects the commitment that IMA has towards educating the students. Very, very thankful for that. And Professor Saravanan. And my dear good friend, Dr. Prasanna here. With all your permission, I am going to speak in Tamil. மாணவர்கள் அனைவருக்கும் எனது மாலை வணக்கம். முதலாக எனது மனமார்ந்த பாராட்டுகள். மேடையில் அமர்ந்திருந்த அனைவரும் நீங்கள் நடத்திய வினாடி விழா நிகழ்ச்சியை பார்த்து கொண்டிருந்தோம். Simply out of the world. Definitely simply out of the world. நாங்கள் அனைவருமே நீங்களாம் பிஜி ஸ்டூடெண்ட் தான் நினைச்சிட்டு இருந்தோம், அல்லது பிஜி முடிச்சுட்டு கூட இருந்திருப்பீங்கன்னு நினைச்சு. நான் கூட ஒரு காலத்துல குவிஸ் கான்டெஸ்ட்ல ரொம்ப ஆர்வம் உள்ளவனா இருந்தேன், குவிஸ் மாஸ்டரெல்லாம் கூட இருந்திருக்கிறேன். பட் யுவர் ஸ்டாண்டர்ட் இஸ் சர்டன்லி அமேசிங். Certainly one of the best I have seen in recent times. Please keep up this standard. உங்களோட அவங்கள என்கரேஜ் பண்றாங்கன்றதையும் ரிஃப்ளெக்ட் பண்ணுது. ஸோ உங்களுடைய கல்லூரி மேனேஜ்மெண்ட்டுக்கும் என்னுடைய மனமார்ந்த நன்றிகள். ஒரு சனிக்கிழமை மாலையில உங்களை ரொம்ப நேரம் இழுக்கிறது எந்தவித நியாயமும் கிடையாது. ஒரு சில விஷயங்கள் மட்டும் நான் சொல்ல விரும்புறேன். ஃபர்ஸ்ட் அட்வைஸ் ஃபார் யூ இஸ் ஸ்டடி. படியுங்க. 2வது அறிவுரை, படிச்சதை மறுபடியும் படிங்க. கடைசி அறிவுரை, படிச்சதை மீண்டும் மீண்டும் படியுங்க. இவ்வளவுதான் உங்களுக்கு சொல்ல முடியும். ஏன்னா உங்களுக்கு படிப்பு மட்டும்தான் உங்க கையில உள்ள பெரிய ஆயுதம். இந்தியாவுக்கு இன்னும் நிறைய டாக்டர்கள் தேவைப்படுது. டாக்டர்கள்லாம் வெறும் எம்பிபிஎஸ் டிகிரியோட அல்ல, அறிவார்ந்த டாக்டர்கள் தேவைப்படுது. நிறைய படிச்ச டாக்டர்கள் தேவைப்படுது. எல்லாவித வியாதிகளும் நீங்கள் வைத்தியம் பண்ற அளவுக்கு உங்களுடைய திறமையை நீங்க வளர்த்துக்கணும். அதுக்கு இந்த மாதிரி கான்ஃபரன்சஸ்கள் உங்களுக்கு நிறைய உதவும். தயவு செய்து நிறைய சிஎம்இ ப்ரோக்ராம்ஸ்ல பார்ட்டிசிபேட் பண்ணுங்க. ஐஎம்ஏ கிட்டத்தட்ட வாரத்துக்கு ஒரு தடவை நடத்திட்டு இருக்காங்க. உங்களால முடிஞ்ச நிறைய பிரைஸ் எக்ஸாம்ஸ் எழுதுங்க, நிறைய காம்படிஷன்ல கலந்துக்குங்க. பேஷண்ட்டை பத்தி டிஸ்கஸ் பண்ணிக்கிட்டே இருங்க. உங்க ஆசிரியர்களை சும்மா விடாதீங்க, டெய்லி போய் அவங்கள டவுட் கேட்டுக்கிட்டே இருங்க. இந்த மாணவர்கள் எல்லாம் இங்க இருந்தவங்க நல்ல பிரில்லியன்ட் ஸ்டூடெண்ட்ஸ். இந்த பிரில்லியன்ட் ஸ்டூடெண்ட்ஸ்க்கு ஒரு அட்வைஸ், உங்களுடைய கிளாஸ்ல எல்லாருமே பிரில்லியண்டா இருக்க மாட்டாங்க. ஒரு சிலர் உங்களை விட கொஞ்சம் ஸ்லைட்டா இருப்பாங்க, ஒரு சிலர் இன்னும் கொஞ்சம் தாழ்ந்து இருப்பாங்க. தயவுசெய்து அவங்களெல்லாம் மேல கொண்டாட பாருங்க. நீங்க தான் செய்யணும். அதை உங்களுடைய ஆசிரியர்கள் செய்ய முடியாததை நீங்க செய்யலாம். உங்க கிளாஸ்ல யார் யார் கொஞ்சம் அவ்வளவு சரியா படிக்கலன்ற மாதிரி உங்களுக்கு தோடுதோ, நீங்கள் தயவு செய்து உங்க கிளாஸ் 100% 100% மார்க் வாங்குற மாதிரி கொண்டாங்க. அந்த பொறுப்பு உங்ககிட்ட இருக்கு. நீங்க ஒரு இண்டிவிஜுவலா ஒரு மெடல் வாங்கலாம், கோல்டு மெடல் வாங்கலாம், அது உங்களுடைய இண்டிவிஜுவல் ஹானர். ஆனா அது சமுதாயத்துக்கு எந்தவித பயன்படாது. உங்களுடைய மாணவர்கள், உங்களுடைய ஃப்ரெண்ட்ஸுகளுக்கு நீங்க பயன்படணும். ஃபர்ஸ்ட் அதற்கப்புறம் உங்களுடைய ஆசிரியர்களுக்கு நீங்க எந்த காரணத்தை கொண்டும் நீங்க உங்களுடைய படிப்பை கைவிட்டுடாதீங்க. எந்த காரணத்தை கொண்டும் உங்களுடைய நேர்மையை கைவிட்டுடாதீங்க. எந்த காரணத்தை கொண்டும் உங்களுடைய சென்ஸ் ஆஃப் ஹியூமர் அண்ட் யூத்தை கூட கைவிட்டுடாதீங்க. இருக்கிற வாழ்க்கை ஒரே முறை தான் வாழ போறோம். நீங்க நேர்மையாக வாழணும், சந்தோஷமா வாழணும், மகிழ்ச்சியா வாழணும். உங்கள் அனைவருக்கும் எனது வாழ்த்துக்கள். நன்றி.
Thank you so much, sir. Let's now move on to the felicitation ceremony. I now request our Dean, sir, to felicitate Dr. Amalor Pavanathan, sir, with a memento and a shawl.
We would like to celebrate the victories of our meritorious students and delegates who have won as a result of their relentless hard work and perseverance. The results of the research paper presentation will be announced by Dr. Nasreen Begum Ma'am, Professor, Department of Internal Medicine, And I request our guest of honor, Dr. Palani Swami Sir, State President, IMA TNSB, to award the prizes to the winners of the paper presentation.
A very good evening to all of. Actually, it is a immense pleasure to announce the winners. And the first prize goes to a very mysterious and interesting case presentation. And it was a case of, it involved a lot of treatment and investigations to Dr. Abhinaya, SRMC. From GV.
Amalur Pavanathan sir, Senior Vascular Surgeon, to award the prizes to the winners of Just a Minute session.
Just a minute. Second prize goes to
round of the quiz which happened today to collect their certificates up on the stage. Our professors from the Department of Internal Medicine. We would like to felicitate Dr. Prasanna ma'am, Professor, Department of Internal Medicine. We request our dignitaries to felicitate ma'am. We are glad to announce that the representatives from Doc Tutorials would like to felicitate our postgraduates of Department of Internal Medicine for their commendable effort in organizing this event. We would like to call upon our postgraduates, Dr. Shivakumar SV, Dr. Yashika Priya, Dr. Niveta DR,
We would like to appreciate our students who helped us in organizing this event by felicitating them. I kindly request all the dignitaries on the stage to felicitate our students with whom this event has become a grand success. I call upon Mr. Surya Prabhu on stage.
Now, we would like to call upon Dr. Nishant S., postgraduate, Department of Internal Medicine, to present the vote of thanks for this evening.
Check. So shall I start, sir? No duty is more urgent than that of returning thanks, said Mr. Bill Clinton. I, Dr. Nishant S., postgraduate, Department of Internal Medicine, Tagore Medical College and Hospital, takes an immense pleasure in presenting the vote of thanks for the successful and extravagant MEDTADCON edition 2022 Internal Medicine Tagore Annual Diabetic Conference conducted by the Department of Internal Medicine of Tagore Medical College and Hospital, powered by Indian Medical Association medical students and medicine. I would like to begin with expressing my gratitude to our everlasting pillar of support, our chairperson, Dr. Professor M. Mala ma'am, and our secretary, Mr. Manigandan sir of Tagore Educational Trust. Our revered dean, Dr. J. Muthukumaran sir, our vice principal, Dr. D.H. Gopalan sir, our medical superintendent, Dr. R. Karnanidhi sir, for extending their support and constant motivation towards conducting these events. I'd heartily like to thank our head Department of Internal Medicine, Dr. T.K.V. Saravanan sir, who is the mastermind behind this entire conference. I'd like to extend my heartfelt gratitude to our chief guests and special guests for the conference. Our chief guest, Dr. J. Amalo Pavandavan, vascular surgeon, guest of honor, Dr. J.A. Jayalal sir, immediate past national president, IMA, Dr. Palaniswamy, state president, IMA TNSB, our special guests and dignitaries of IMA TNSB, President-elect of IMA TNSB 2023, Dr. Singaravelan sir, Vice President, East Zone, IMA TNSB, for spending their valuable time and gracing us with their presence throughout this event. We are extremely grateful and thankful to have such eminent national and international guest lecturers who shared their knowledge and the moderators who presided over every program. I am pleased to thank our supported organizations, Indian Medical Association, Medical Students Network, and Medicine for extending their support to this event. I'd like to express my immense gratitude to every member of the organizing committee of MEDTADCON 2022 and faculty of Department of Internal Medicine. Organizing Secretary, Dr. Prasanna KB ma'am, Scientific Committee Chairman, Dr. Nasreen Begum ma'am, Dr. Rajasekhar sir for judging the poster presentation, Dr. Balaji sir for his contribution towards Food Committee, Dr. Aishwarya ma'am, who is the key person in organizing the Scientific Committee, Dr. Mohammed Kamil sir and Dr. Rishi Kumar sir for their work in the Transport Committee, Dr. George Raj Deva sir as a knowledgeable quiz master, and other associate and assistant professors and senior residents. I would also like to thank my fellow postgraduates, Dr. Sivakumar SP, Dr. Yashika Priya R, Dr. Niveta DR, Dr. Manigandan G, Dr. Sibin R, Dr. Murali A, Dr. Satish Kumar L, Dr. Ari Krishnan S, and last but not the least, Dr. Sweta S. I would also like to thank Mr. Karthikeyan, who helped us to organize this event very smoothly. Mr. Sasi, who helped us with the transportation. Mr. Francis, who helped us with photography. Mr. Jenny and Mr. Munesh Swami for helping with us in technical support. We would like to thank Ozona Decors for arranging the stage decorations. We would like to thank the catering services and food committee for providing food for the event. I would like to commend and appreciate our students of Tagore Medical College and Hospital, Excel Series batch of 2017, 2018, Reveliance batch of 2019, the Student Council of Tagore Medical College and Hospital. I have a few special mentions to announce. I would like to thank Dr. Raghunandan Ramanathan, who also represents Medicine, for his contribution towards planning and executing this event. MCs for the event, Mr. Surya, Ms. Vaishali, Mr. Keshav, Ms. Neha, Ms. Aparna, Ms. Swati, Ms. Pooja, and Mr. Parthiban. Video content editors, Mr. Ajay Mani and Mr. Abhishek. All committee members, Mr. Joel Stewart and Ms. Kriba Arini. Rangoli team and technical team, Mr. Aryaran and Mr. Leander Sam. Paper and poster presentation, Mr. Jayasurya. Reception team and transport team. And every student who volunteered for putting in hard work and effort over the past few months to make this event very successful. I'd like to thank its faculty and staff of all departments of Tagore Medical College and Hospital. I'd like to thank the IT team and technical support, non-teaching staff and security staff for their support. I'd like to thank the housekeeping staff for helping and cleaning the hall adequately in spite of heavy rains over the past 2 days. Last but not the least, I'd like to extend my heartiest congratulations and gratitude to the success of this event. I hope that everything you have acquired over the past 2 days will be of immense use to you, and wish you all the best for your future professional endeavors. Thank you one and all for making this MEDTADCON 22 a very grand success. Thank you very much from the bottom of my Parkinji fibers.
We now request you all to please rise for the national anthem.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाता जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय जय जय